Chapter 18, Geriatric Emergencies. A geriatric patient is somebody that's older than 65 years old, and there's about 52 million people 65 and older. I presume it's in the US. The population is expected to double by the year 2060. Natural aging process results in a decline of functioning of all the body systems. Important that we don't prejudge physical or mental condition of older patients. Most EMS systems respond to many calls involving geriatric patients. You should conduct a complete secondary assessment on all the patients, unless, of course, they have a life-threatening condition and need to be assessed and maybe CPR done straight away. The most socializing senses, hearing and sight, are things that change the most during these times. Many people experience some sort of hearing loss and sight as the age go on, to the extent that hearing aids and they don't work so well and things. Driving and walking becomes hazardous. There's often a lack of muscle coordination, things like that. They trip and fall, especially on uneven surfaces or slippery surfaces. And we all know that that's not good for bones and things. Impaired vision and confusion contribute to mistake in taking medications. Taking an overdose of insulin or something like that can be life-threatening to these people. Okay. Certain inner ear disorders are more prone to poor balance and things like that. Again, we're falling. Okay, communication can be difficult with especially older patients. Older patients tend to be a little bit more difficult in general. Their whole attitude, okay? So just be careful, identify yourself, speak slowly and clearly, because there's a bit of a stigma sometimes that older people think that you want to help them just because they're old, not because they need help. So just be careful, okay? Don't ever shout at your patient. Okay, ask he or she if they can hear you properly. Speak directly into the patient's ear. Good side. Maintain eye contact, especially with those people that read lips. Okay, and if you're still having problems communicating, okay, offer a pencil and paper and they can write it down. Use sign language if you know how to do it. But generally, a good positive body posture and things like that helps in overcoming difficulties. Okay, look for signs indicating visual impairment during the scene. Size up eyeglasses, canes, service dogs maybe. Blind people would have a dog that helped them walk where they wanted to go. Visually impaired patients may feel vulnerable during an emergency. Okay, tell the patients what's happening on. Describe what's going on around them, the noises, the smells, people talking, sometimes people shouting, things like that. Okay. Find out the patient's name and use it, preferably on a first name basis. You establish a bit of a rapport with the patient, and the patient starts to relax and feel more at home with you dealing with him. Possible, keep the glasses with the patient. There's two things that an old person is most afraid about: their teeth. Okay, especially dental implants and things like that, or false teeth, and the eyeglasses. They can't see anything. They feel lost. They feel abandoned and lonely if they can't see what they're doing. Okay, when we identify ourselves, we look directly at the patient, speaking slowly and distinctly. Use simple language. Listen to the patient. If you have to repeat yourself, repeat the same words, using simple, easy to understand words, especially if patients a little bit difficult hearing and the English isn't as good as what it should be. Okay, show the patient respect. Don't talk about the patient in front of the patient. Be patient. There's lots of patient things there. Okay. As age goes on, several changes occur with the musculoskeletal system. Muscles lose strength. They begin to weaken. The disc between the vertebrae become narrowed, which can cause loss of height, curvature of the spine. Okay, they lose their flexibility. Bones in the skeletal system lose their density. They become more brittle. And old people are clumsy. They overbalance, they lose their balance, they topple over sometimes. Just got to be patient with them, just got to help them. As a result of these increased incidence of falls amongst the older patients, okay, and therefore there will be an increased chance of injury to the brain. Blood vessels are more fragile, the brain gets smaller as a person ages. So it moves around a lot more in the skull as well, hey? As a person ages, movements become slower. Lend them a helping hand, supporting arm. Allow them enough time for patients to move safely rather than trying to rush them. Just go along at a slow pace, even if it is a snail's pace. Fractures occur frequently in geriatric population because of loss of bone density, often results in osteoporosis. Fractures of the wrist, spine, hips are common in older people. Geriatric patients have a reduced awareness of pain. Nerve damage is also one of those things that happens in older people, especially people with diabetes and things like that. Old people tend to develop these things. Hip fractures are common, result in osteoporosis, most frequently in women. A injured leg is usually, but not always, shortened in relation to the other leg. The toes of an injured leg are externally rotated, so they point outwards at 90 degrees. Sprint the patient and rapid transport to hospital, prompt transport to hospital. Remember that these people need to be handled very carefully. Fractured hips, there's a lot of nerves and blood vessels in that area. So if you can't do it for yourself, make the patient as comfortable as possible. Stop them from moving too much and wait for help to arrive. Conditions that may occur with advancing age, a good little table: loss of hearing, loss of sight, loss of sensation, slow physical movement, fractures, a bit of dementia and senility, quite often loss of bowel and bladder control. These are just a few of the things that you might come across. As people get older, they're generally less able to fight off diseases. Their immune system becomes less effective, and they are not often able to cough effectively. Quite often, these older people start having difficulty handling secretions. Sometimes they can't swallow properly as well, especially when there's a B vitamin deficiency in these people. Cardiovascular conditions that may affect the heart and blood vessels. Definitely, as a person ages, the body loses ability to speed up heart contractions, and the blood vessels become stiffer and narrower by fatty deposits. These increase the occurrence of angina, heart attacks, and congestive cardiac or congestive heart failure, CCF or CHF. Always remember that good deep nasal breathing, okay, relaxes the arteries and allows those narrowing arteries to be open slightly. Risk of strokes and abdominal aortic aneurysms are common conditions related to blood vessels. Geriatric patients may not have classic signs and symptoms, but older patients have decreased awareness or sensation or to pain. Always treat the older patients with a high degree of suspicion, especially if things don't look, or they don't look like there's anything wrong. There's always something underlying. An old person will always tell you that they're feeling good. There's nothing wrong with them because they don't want to be a burden. But when you get down to the bottom of it, you actually find that there's something that you can do to help them. Okay, respiratory diseases. Obviously, as age goes by, alveoli lose some of the elasticity and things, and muscles associated with respiration become weaker, intercostal muscles, diaphragm, things like that. Two major respiratory diseases in old people are chronic respiratory diseases or acute respiratory diseases. Patients with chronic obstructive pulmonary disease, COPD, may live with this condition for many years. A cold or other respiratory infection can result in medical emergencies. You'll find that those type of people with chest infections, they get pneumonia very easily, other funny things. pleurisy. And obviously, if they're falling a lot, there could be a chance of fractured ribs, things like that. All things that could make a life a lot difficult for them when it comes to breathing. Tension pneumothorax, if there's punctured in the lungs and things like that from broken ribs or anything like that. Contusions on the lungs come to mind as well. All right, always treat or examine the patient very carefully. Secure an accurate medical history, past and present, sample, dots, head-to-toe inspection. Okay, always treat the patients presenting symptoms and arrange transport for them to a hospital or a appropriate institution. Cancer can strike any part of the body. Okay, patients will call when the complaints with cancer result from acute pain, shortness of breath, shock, and some other medical conditions sometimes. Provide support and transport to a medical facility. Remember, every step is painful for these people, so take it slow. Altered mental status, that's unfortunately quite a common occurrence in older people. Okay, inadequate breathing, got lack of oxygen to the brain, low blood sugar, glucose levels, hypothermia, all these type of things can cause altered mental status. Unfortunately, things like dementia, Alzheimer's, things like that, also hardening of the arteries. All of these things are part of the things we have to deal with in getting older. Assess the patients, provide treatment according to the signs and symptoms you note, and always provide transport to an appropriate facility. All right, many older people take large amounts of medications every day, handfuls of pills sometimes. They may see several doctors for different conditions, cardiac, neurology, GPs, and things like that. Some medications may interfere with the actions and cause severe adverse effects, like your tablets clashing with each other. They may not take their medication as instructed. Some people, older people especially, some of those with dementia and things like that, become very difficult. And they would refuse to take their tablets, or they put their tablets in their mouth and hide them away from people, and then spit them out when you're not looking again. So you need to make sure that these kind of people are taking their stuff as instructed. Always determine what type of medication the patient takes. And if the patient has been transported to the hospital, take all medications with you. Okay. Some old people forget what they have to take and how they're supposed to take it. And they end up just taking a handful of stuff that might be harmful to them. Infections and sepsis is definitely a problem in older people. Okay. Thinking about viruses and bacteria and fungi and things like that. May affect different parts of the body, different organs, different systems. Older people have a weaker immune system, so signs and symptoms from infections and sepsis, just remember, for fever, fatigue, coughing, muscle aches, diarrhea. Okay, and then if it's an infection, always remember heat, swelling, pussy discharges from areas, and then if it really gets bad, smelling in certain areas. So severe sepsis is a severe, potentially life-threatening complication of infection. It occurs when chemicals are released into the bloodstream, which result in an infection. Mostly it triggers an inflammatory response throughout the body. Inflammatory markers go up. Most common in older patients who have weak immune systems. They can progress to septic shock very quickly, and death will result. Need to be treated very quickly in order to get the old person to get through that. Okay. If an older patient shows signs and symptoms of an infection, he or she should be evaluated by a physician to rule out any possibility of infection or sepsis. Okay, patients who require long-term care. These people that require carers and things like that. Patients with many chronic conditions are treated at home by nurses or carers, family members. A variety of complex medical devices can be used with these patients. some things like ventilators, oxygen enrichment devices or oxygen generators, surgically inserted breathing tubes, monitors. Make sure that all of these things are working and in good condition, charged if you need to transport the patient and take the things with. Certain patients may have pacemakers or automatic defibrillators implanted in their chests, or tubes inserted in the patient's arms, necks, and stomach to provide fluids or food. Catheters may drain the urine from the patient's bladder. These patients often take a wide variety of medications. Well, there's a pill for everything for these people. Okay, there you go. There's a feeding tube, and that would be a dialysis machine or something like that, or something for breathing. One never knows these people. Okay. Remember, as your role as an EMR, emergency medical responder, assess the immediate problem. Okay. Always with these old people, with anybody, in fact, primary survey, secondary survey, and if appropriate, to treat for shock, care for the patient. Bleeding, breathing, and other illnesses, always. Okay, old people going to shock very, very quickly. Appropriate steps should be taken to provide care immediately. Don't get overwhelmed or distracted by the complex equipment that's around you. Question the patient and the caregivers. Most situations, you will need to stabilize the patient only for a few minutes until more highly trained EMS personnel arrive. Depression in old people, especially when their family tends to forget about them or they're stuck into an old age home, they just get left there by themselves. Okay. It used to just be a very rare occasional thing that happened, but seems to be on the rise. Between 1% and 5% of old people suffer from depression. Rates of depression significantly rise with loss of independence. Okay, if the patient already had a bit of a problem, it's just going to get worse. It's more common in women than men. And contributors, definitely contributing factors, loss of independence, living into nursing homes, living on their own, loss of a spouse or a close friend. You must know these old people alive 60, 70, 80 years, 80 years, 90 years. They've lived with a husband or a wife for 50, 60 years, and all of a sudden they are left on their own. It can never be a good thing. It's very traumatic, very disturbing for them. Declining health, chronic health conditions and terminal illness just makes things worse. And they feel like sad and like there's nobody, no happy outcome for them. So they just become worse and worse and worse and end up living in the depths of despair. Okay, if you bring it to the attention of the EMS and other medical professionals, maybe they can do something to help the situation, make them feel a bit more peppy. Suicide amongst old people, old men especially, don't want to be a bother to the society, a bother to their family, and they turn to more lethal means of doing things, resulting in deaths from suicide in this group is quite increased. Factors that contribute to physical illness, especially terminal ones, loss of a loved one, alcohol abuse, and just left to be on their own. Sometimes just being by yourself is very, very bad for these people. Listen carefully to these patients and be alert for indications of hopelessness, depression, attempted suicide, to look for marks in the patient, signs and symptoms. Okay. If you suspect this patient may be considering suicide, you can always arrange transport for them to the appropriate medical facilities where the people that are trained to take care of them can do so quite well. All right, dementia, the difficult one. As a form of decline in mental function, the marked impairment for memory may result in a decrease in reason, judgment, comprehension, and ability to communicate verbally, something that most of us, if you know old people, will realize when it's happening. Okay, 20-40% of older people older than 85 have some degree of dementia. The causes of dementia could be heart strokes, hardening of the arteries, hereditary conditions. Okay, things like a life of smoking and things like that could increase the chance of hardening of the arteries. things. All right. Alzheimer's is a very common cause of dementia. One would have to be able to do some sort of a test to test the susceptibility of these patients for Alzheimer's. Chronic degenerative disorder attacks the brain, resulting in impaired memory and behavior and thinking. In situations I've been seen, the older people can remember things from years gone by, from donkeys years ago, but they can't remember what happened yesterday. With Alzheimer's and in terminal stages, people may be unable to walk, lose bladder control, bowel control, and be unable to swallow. Definitely the neurological function is decreased. Okay, when caring for patients with dementia, we need to speak clearly. We need to use the patient's name. Let the patient know what's going on with each step. Okay, and you might have to repeat yourself over and over and over again. What you say on day 1, you will have to say on day 2. Maybe you have to say on day 3 again. Because these people don't remember. They don't remember who they are, and they don't even remember their family members quite often. Sometimes you need to rely on family members and carers for an accurate medical history. Always use a kind and caring approach. Always lower yourself to the person's level. Look them in the eyes. Speak with a kind voice and be caring. Lots of empathy might be needed. A hospice is a healthcare program that brings a variety of caregivers to provide physical, emotional, spiritual, social, and economic care for patients who have terminal illnesses, those that are expected to die within 6 months. Interdisciplinary programs provide pain relief and other supportive care. Okay. Pain relief is often provided through oral medication, specific pain-relieving tablets. Medicine is placed in the cheek, between the gum and the cheek. I know that in some cases with terminally ill patients, they would be on an infusion pump, which regularly injects them with a metered dose of some sort of things. That's all right, Candy. Okay, always document all things carefully. Okay. Pay care for patients what they want to receive if they are not able to make their own decisions. Remember, sometimes they're really not of sound mind, and we would always assume that they would want help, especially if their families wanted. Okay. Do not resuscitate. DNR is a request to withhold CPR for other life-threatening measures. Patient's heart stops or if he starts breathing. MOLST, medical orders for life-sustaining treatment. Sometimes it's better just to look at the patient and decide whether you would like to do resuscitation or not on these patients. We always try and provide life support or CPR for patients that have passed. But in some cases, some people actually don't want to be, or there is no need to help these people. We need to know the regulations concerning these documents in our state or our country. DNRs are usually a legal document between a surgeon, a patient, and some sort of authority figure. Okay, if you cannot determine whether the advice directive is valid, begin appropriate medical care and leave messages for the physicians. Remember, always transport to a medical facility as soon as possible. If one suspects there's abuse of elders, which is quite common, unfortunately, okay, especially from a family member, a spouse, or caregivers. Caregivers seem to be the #1 sinner in the situation. Elderly abuse can be physical, sexual, emotional, or financial, especially if a person is left on their own without anybody else but their carers. By the time you realize there's some sort of abuse going on, it's already so far down the line that it's hard to stop. Okay. Signs and symptoms of sexual elder abuse. Definitely bruising, burns, trauma to the genital area, signs of neglect, pressure sores, people aren't being moved or turned over regularly. Remember, pressure sore will develop very quickly, especially in a case where the circulation is compromised already, okay? And then the patient's skin circulatory system to the skin is compromised and that tissue starts to die quick. Okay. If you suspect abuse, report it to the authorities. Many community-based programs assist with supporting geriatrics who are in need of physical assistance, nutritional support, and emotional help.